explain to us what cholesterol is all about, what the function of cholesterol is in our bodies, and when it is high, the side effects, all right, and how to manage it. That's how to ensure that you have the right level of cholesterol in your system. Plus, we bring you the highlights of the 2025 Scientific Conference of the Association of Nigerian Private Medical Practitioners, ANPMP, Lagos State Chapter. On that report, the focus was on how to ensure that there's public-private collaboration in the health sector. That's a report that you wouldn't want to miss. Plus, we also bring you a jingle, public service announcement on family planning in different languages. You know how I love to do this with you every week. We'll go on a short break. When we return, Health Watch continues. My name is Nkem Okibe. Stay with us. Health Watch continues in a moment.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow-operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.
Cholesterol, in layman's term, is referring to the fat level in the body or in the blood, and there are different types. When you're talking of it, you have the LDL, the low density lipoprotein, you have the HDL, the high density lipoprotein, and you have the triglycerides. So you see, in the blood, the HDL is also what we call like the good type of the fat, and this one can be high, but the LDL, it has to be low. Many people that have hypercholesterolemia in their blood, they are posing a risk to certain medical conditions. One of the most significant of these is cardiac function or cardiac arrest, because if you have high cholesterol, it's going to accumulate in the vital organs, and the way you will know somebody who has high cholesterol, even without running any medical tests, is that these people have excessive fat deposited in certain parts of their body. This is even from women. Women have fat deposited in their breast and their butts. That's normal, and that's part of maternal functions. But you just see someone having excessive fat in the abdomen, and you think this person is pregnant, whether a man or a woman, and it is not fibroid if it's a woman. This excessive fat can be deposited around the liver, around the heart, around the kidneys. It can even be deposited excessive in the intestinal area, which we call omentum or greater omentum. So if we have high level of fat deposited in these parts of the vital organs, the person is having a higher risk of, if it's in the heart, of having cardiac arrest or myocardial infarction, because it's having excessive cholesterol in the blood system and also surrounding the organs. Also, if you're having excessive cholesterol, it could also yield or result into hypertension. The person can develop high blood pressure. The person can also develop diabetes. So there's something which we call syndrome X. Syndrome X is where you have high level of cholesterol, you have high blood sugar, you have obesity, and you have all other comorbidity or comorbid disorders. Somebody who has high cholesterol, there are certain things you can do to know. Number one is you take a blood test. There's something called a lipid profile. Lipid profile is going to show the cholesterol level, the HDL, the LDL, triglycerides. That is one way. Also, there's another way you can know without taking a blood test if you are healthy or not. One of these ways is when you do what is called a BMI, body mass index. So you have the normal and you have when somebody is massively obese. For example, the BMI compares your height to your weight. It's called kilogram per meter square, or weight all over height times itself. So there is a fixed number which it should be. If it is above that, the person is obese. If it is less than that, the person is underweight. So this is another factor which you look at. Then we are to look at a major factor also in cholesterol, is that dietary control or lifestyle modification can affect the cholesterol level in your blood. We advise everybody to exercise at least 30 minutes a day, even if it is just walking, brisk walk. I'm going to tell all of you something. Those who are married or you have a partner, regular sexual intercourse is also a good form of exercise and stays fit. That is why regular intercourse between the man and the woman is something which can also improve the cardiovascular system and improve healthy lifestyle for both couples, because there's activity involved. Walking also is a good form of exercise to keep fit and burn down this fat and burn down this cholesterol. Now we're also looking at diet. Take lots of fruits, eat lots of vegetables, reduce excessive starchy food. Many people think until you eat a whole bowl of eba, cassava, apple, all these things. No, you don't eat too much. Instead, take more of proteins. And even in that, you do it with moderation. Then drink lots of water. Also, things that can worsen your cholesterol level are things like alcohol intake. Excessive alcohol intake can worsen it. Beer, all these things can also affect or worsen your cholesterol. Also, excessive sugar intake. You like ice cream, cakes, bread, lots of it also can worsen it. Take more of vegetables. Eat well and maintain a good, healthy lifestyle too. But I would also want to end this note by saying that cholesterol itself is not bad. Even in our seminal fluid, there is also level of cholesterol in it. Even in the egg, there's also level of cholesterol. In our brain, we still have fatty matter. So it's not that cholesterol is completely, even the cortisol that we use associated with food and also in the night helps us to sleep well, there are cholesterol in it. So it's not that it is completely bad, but excessive of it can lead into cardiac arrest, can lead into stroke, can lead into obesity, syndrome X, can lead into diabetes and all other severe medical conditions, kidney failure, renal failure, heart failure, and even can lead into bone degenerations, fractures, and all other conditions that we cannot mention due to the constraints of time. Thank you very much. I'm Dr. Love, and we love you.
Thank you so much, Dr. Love. That was very, very enlightening to know that this is the function of cholesterol and how to ensure that you keep up a very good level of cholesterol in your system. Moving on, we'll bring you the highlights of ANPMP Scientific Conference and Annual General Meeting. Let's see this together. We'll be right back. The 8th edition of the Annual General Meeting and Scientific Conference of the Association of Nigerian Private Medical Practitioners, ANPMP Lagos Chapter, was held on the 10th and 11th September 2025, themed Building Resilient Private Healthcare Systems in Lagos State, a driver of public-private collaboration, economic stability, and good governance. The event featured lectures, exhibition, and other brainstorming sessions. Speaking at the conference, the chairman of ANPMP Lagos chapter, Dr. Jonathan Esegine, highlighted the widening gap in healthcare delivery in Nigeria. He identified critical challenges such as poverty, inflation, inadequate infrastructure, and limited access to essential health services.
It has also brought to the fore the numerous challenges which are undeniably here with us, e.g., our exploding population, growing poverty rates, hyperinflation, grossly inadequate infrastructures, especially lack of energy, cost of care, affordability, especially to the vulnerable members of our society who are clearly the majority. This is where the members of this association have filled and continuously filled the gap, providing accessible, affordable, and always available primary and even secondary care because of our presence everywhere, urban, semi-urban, rural areas, even at enormous cost to individual facilities. This most unfavorable environment, the Nigerian private medical practitioners has carried on stoically, preserving, promoting, and defending the health of the people, mostly at the grassroots. This makes this year's conference theme, Building Resilient Private Health System in Lagos, a driver of public-private collaboration, economic stability, and good governance, very apt. And with the well-appointed speakers and panelists, I am confident that the issue will be significantly addressed with appropriate recommendations to appropriate authorities.
Notably, private medical practitioners cater to 65% of patients in Nigeria, underscoring the need for stronger collaboration with government to meet the nation's healthcare demands. This was reinforced in a thought-provoking keynote lecture delivered by Professor Dr. Francis Adedayo Faduyile, former Nigerian Medical Association president, who emphasized advocacy for government recognition of the vital contributions of private medical practitioners.
There's also a need to interact with government and private practitioners to encourage horizontal referral as against medical tourism that bleed our country. Some of the private facilities have and properly maintain equipment that are needed and used in these medical tourist nations. A proper PPP arrangement can be made to bring in those equipment in such facility to use in Nigeria. The public medical practitioners can also interact with these centers to improve their knowledge and expertise. We should always put it in mind that almost all medical tourist health institutions, either wherever, in UK, in India, anywhere, are privately owned. Most of them. So what stops us? Hence, we need to develop our own. It's a clear call to all of us here. We need to support reverse migration of highly skilled medical practitioners by providing an enabling environment in our private institutions to support the collaboration. Many of our people outside the country are willing to come home. The federal government, the state government cannot take care of what they need. The private practitioners can do that. Let us give them that opportunity. Improve your practice, give them room to be able to work, and let people know. I think when you have that, it's a good collaboration that you do with the government.
Other participants and stakeholders also stressed the need for robust public-private collaboration.
The problem between the private practitioners and the government has been a lot of government policies that are anti-private practice. If we are not being confrontational then we have to find a middle course to sit down with the government or their agencies and negotiate ways forward. We are putting everything in place in our practices to make sure that we provide the best to complement what government is offering.
We need to come with more figures. We need to come with data and let government know these are the challenges, and you want us to do this, you want us to do that. This cost we cannot put on patients, because if we want to put the total cost of what it takes in the private sector, an average Nigerian will not have access to health care. So more or less the private sector is doing quite a lot of social services.
We are saying government needs to give desired recognition to private sector participation in healthcare delivery. And we need encouragement. There are so many challenges. We have named so many of them, a plethora of them. So we need that support. Like offering of loan, single-digit loan, will go a long way to promote private participation in healthcare delivery.
The need for collaboration cannot just be overemphasized. What is important is to ensure that the government is on the table to do the regulation, because at the end of the day, the government is funding it. The government is creating a regulatory framework to it. So it will eventually enhance and improve on the statistics.
The conference highlighted new strategies for partnering with the government for sustainable health care.
We need to find a way so that the public-private will know that we are serving the same set of people, the patients, who are supposed to be taken care of by the government as it is. That's the primary thing. In the Constitution, the Constitution says that the government should, as part of its duty, to ensure that we have proper health for the people, and that's why we have the National Health Act. But importantly, we need to now change the tactics of how things are, and I think that is what we have discussed here, for the private people now to be a driver of getting the government to do the needful, so that we will now understand that there is more than enough need now for us to have that partnership, so that we can now assess after a while.
Overall, the annual general meeting served as a platform to deliberate on best practices to deepen collaboration between government and private medical practitioners, with the goal of strengthening Nigeria's healthcare system. Wow, interesting report there. 2025 Scientific Conference talking about public-private collaboration in the health sector. Of course, for a sector that provides about 65% in the sector, of course, it calls for the government to also collaborate with them and see ways to strengthen the Nigeria healthcare system. Moving on, we have this public service announcement of the benefits of family planning in different languages. Enjoy it. We'll be right back.
Me, I feel say family planning, you help husband and wife for good health, so that at least they can last. And in the other way around, now to allow the woman and the man to have the children that they can be able to train. Because if family planning no there, me I don't know, people go born not less than 10 dozen.
Family planning na-enyelu di na nwunye aka ka ha dị ime oge ha chọrọ. Family planning na-eme ka nwaanyị ghara na-aya ọya ọbụna, ma ọya dị iche iche, ma ọya ma ụmụ ọya mgbochi.
Family planning tí à ń pè ní ìtẹ̀tẹ̀ ọmọ bíbí ni pé kí àwa àti ọkùnrin àti obìnrin kò yẹ ká bí wọn rẹpẹtẹ ju tí tágbára wọ̀ ní ká lọ. Tí a bá máa bí bó jẹ́ méjì mẹ́ta ká bí kọ́lọ́ ká tọ́ ọmọ wa nítorí bí gbogbo tá a ṣe ríǹsì nǹkan wọn oúnjẹ wọn bọ̀ tí wọn bá tá a bá bí ká tọ́ kó yanjú kọ́lọ́ kó fún wa bí.
Ya kamata su yi family planning saboda suna rage samun damar 'ya'yansu su ƙara girma kamin su samu wasu 'ya'ya su su zo gare su idan suna yin family plan za su samu sauƙin abin nan gare su saboda haka ne ake mutane gargaɗin cewa su continue da ko mace wanda yana da mata ya yi matan shi ta je ta yi family planning saboda ta samu sauƙin 'ya'ya haihuwa.
Thank you so much for being part of this week's episode of Health Watch. You know how I normally say it, health conscious people live longer. You have questions, you have an inquiry, of course you would love to sponsor this program, then send a mail to orkibenkem@gmail.com. Send a message alone to 07060865487. Keep it date with us next week, same time, same station. My name is Nkem Okibe.